at our institution, I think the biggest hesitancy that I saw in my colleagues was they were worried about not being able to examine their patients. So I think that was the number one concern that I saw. Otherwise, it depends on what your IT support is and choosing an actual platform. Luckily, during COVID-19, they have reduced some of the rules about what you have to use. So I have colleagues so they could get this initiated quickly and keep seeing their patients safely. They're even using things like FaceTime and Skype. And so for right now, during COVID-19, that is allowed. Luckily, we had access to an institutional Zoom where we have all of the HIPAA-enabled rules for it. But that is a concern. And I mean, you've probably seen reports of things like Zoom bombing and all of that stuff. So there are some concerns about what that sort of safety is in terms of privacy. Right now, we're doing the best that we can in light of a public health emergency. And I'm sure over time, as people continue to adopt this, we'll reinitiate the things that have to be done to make sure that we're doing all the privacy concerns that need to be done. But those probably were the biggest concerns that I saw brought up. If we can give a silver lining to this horrible situation, it's that medicine has actually moved into the current century. We were really behind in terms of this, and it's such an amazing tool. I have patients who drive hours to see me. I have patients who come from other states. I mean, some people even see international patients. And sometimes all I need for a follow-up is 5 minutes. And so if I can do this over a telehealth visit, why make the patient drive all this way or fly in when I can get the majority of what I need over this, or perhaps everything that I need, and only have them come in when there's a reason I really need to examine them, say like do fundoscopy or something like that. And I might be able to even get them locally to be able to get their fundi checked and send those fundus photos and OCT to me. So I don't even need that. So it's such a great tool, and it's so patient-centered. For my migraine patients, a lot of them, they feel awful. If they're in the midst of a migraine attack, they might be stuck in bed, they're sitting in the dark, they might be vomiting. The last thing they want to do is stand up when they feel dizzy and lightheaded from it. And for them to be able to sit at home in their comfortable clothes with, the heated pad or the ice packs on their neck, and not have to go and get out and actually try to make themselves look like they can present themselves to society, and know that I'm going to understand, like I'm okay seeing them like that. That's such an easy way to see a patient who here, we try to see patients in the dark when they're not like that. And, we can offer, they're going to be more comfortable in their home in a lot of those settings. So I think it's just such a great resource. I 100%, as long as we are allowed, will continue to see follow-ups that way. New patients, I will probably convert back to doing in person, unless there's some exception that I think is warranted. I have to say, social media for me has been an amazing tool and support during this. There are some great groups that I follow. So for instance, on Facebook, we have Migraine Mavens, and it's these wonderful, powerful, influential women that I've been able to collaborate with. And a lot of them actually are some of the people who did this Facebook Live. So like, Dr. Duvall did the one just before me. We've got, I think there's one actually even today, for instance, and again, she's from our group. So Melissa Rayburn. So like, we've got so many different exciting things like that. I've been collaborating with Nina Riggins, who did one again a couple weeks ago. So it's been a really great resource. And actually that's where a lot of this communication has come from, is we were talking about telemedicine. We were like, we need to get the word about all these great things we're talking about. Like we should actually share this with other people, for those who aren't part of this group that we have. Same, we have a great women in neurology group, where we've been able to share a lot of this. And this is a nice way to kind of extend it beyond those individual groups that we're in. But it was actually inspired from those groups that we did this. And they've been just a great source of friendship and just knowing that you're doing the right things, I think. This has been a tough scenario. It's scary for so many people. We're seeing patients and even, healthcare providers becoming patients who are just horribly impacted, and everyone's scared right now. So it's great to know that we haven't forgotten about our patients who aren't COVID-19 patients, and there's ways that we can provide that care, and then also support our colleagues, which is what things like this do.